We welcome you. We just felt like as we head into the holidays, we're running into some areas that we felt people could really benefit from some clarity. And so we've been really digging down on getting clear on a few things. And we've been working really hard with our partners at County Health to prepare an update on holiday guidance around COVID. So Patricia, are we going to put that out today, the holiday guidance?
Yes, I'm going to put a link in the chat to it, and it'll also be in these slides.
Okay, great. So that's being released today, and so we wanted to just have a quick refresher on COVID protocols. We've been, everybody does their best out there, and then we learn that maybe someone's not following it quite the way it should be, and so rather than kind of reach out and try and guide everybody individually, it just seemed like a better idea to pull folks in and go through some things. Maybe you'll come away today with some new understanding or a little bit more clarity on certain policies, and also we'll leave plenty of time for your questions. So we're going to go ahead and get started. That's kind of the context for why we're here today. Sorry, clearing my throat. So welcome, and we're going to talk about and Patricia, before I get started, or Jill, we also may be joined by some of our, yes, we do have Dr. Curtis Chan with us today from County Health. So welcome, Dr. Chan. And I see Justin Watkins also on the call as one of our county health partners. So good morning. We're just getting started. County Health is on the call to talk about, we are going into what we'll call the winter surge. We're seeing a rise in cases, and that makes sense based on how COVID behaves, because it's it's a respiratory transmission. Oh, Jill, can you go back? Can you go back a slide, Jill? Thanks. So I was just talking about the situational awareness. So we are seeing some rises in cases, and County Health can answer any questions you might have about that. If there are any mask guidance updates, we'll discuss them today. We're not sure. That was, we know the state is working on that. Talking about contact tracing and if you need assistance with that, COVID testing, vaccinations, and then our recommendations for COVID safe holidays. So that's our agenda for today. Please put comments, questions in the chat as we go. Patricia Love will keep an eye out and facilitate as we need questions. Okay, next slide. So last winter holidays, you may or may not remember, but I remember very well that we really didn't get much of a break. Last year, we didn't have wide scale, high percentage of anybody being vaccinated. So when people were getting sick with COVID, many people were getting very sick. And that's what the vaccine does for us. It doesn't necessarily prevent us from contracting COVID, but it prevents us from having severe illness, hospitalization, and worse. So last year we were in a much worse situation in our hospitalizations, ICU counts. The health system was definitely taxed to its capacity and beyond. And it was quite a different level of emergency. So even as we go into the holidays and experience a winter surge, which means more and higher numbers of COVID cases, we don't expect the level of emergency we had last year. So today we'll look at that data, and we did learn from our colleagues at the state from California Department of Public Health that in this winter surge, they're seeing that right now the highest number of cases are in the 5 to 11-year-old group, which is also sort of new. We didn't see that last year. The 12 to 16-year-olds have the second highest rate. And you wonder, well, why would that be? And you think about the situation with vaccinations and you ask yourself, well, who's the group least likely to be vaccinated right now? And it is, 5 to 11-year-olds and 12 to 16-year-olds. So, and then I'm not sure, Jill, what this bullet is about many other viruses with similar symptoms. Does that mean people may show symptoms and it might not be COVID? It could be many other things.
Yeah, just that it's the winter season. So there are a lot of other viruses out there now, and that look like COVID too. So that's just another challenge that we have during the season.
So Dr. Chan, like to just invite you to just say hello to everyone and also just sort of reiterate kind of my interpretation of this data as far as who's showing the highest rates of COVID cases right now. Is this directly tied to vaccination rates?
Yes, it is tied to vaccination rates, and it speaks to the challenge that we're going to have in this winter. It's not going to be as dire for all of public health in terms of the total number of people hospitalized and dying, but I just want to honor for you all that you have a tough kind of a logistical administrative task ahead of you to balance, because many children 5 to 11 haven't been vaccinated yet, but once they are vaccinated, as you all know, then they don't need to be quarantined and they don't need to do modified quarantine. So it's a big race to do that. And this point that Jill highlighted about many other viruses with similar symptoms, we talk at the state health department and locally all the time. And flu looks like it's gradually going up right now, and there's plenty of RSV, rhinovirus, these viruses that cause a common cold. That the teachers, administrators have a difficult pathway ahead of you all in terms of like thinking about what the protocol would be for like a runny nose and cough, the combination of symptoms for COVID. There's algorithms from the CDC and CDPH. I just want to recognize it's not an easy thing to figure out, because so much of the risk is evolving based upon the likelihood of COVID in the community, the likelihood of the virus in the community, and the likelihood you're going to cause transmission because children are being immunized and protected as we speak. So, we have these dilemmas even for, as you all know, for strep throat and influenza. When somebody has like a little bit of the itchiness in their hair, is it lice? I think I've been struggling and thinking about best protocols for health departments for like close to 20 years for doing this. But this is even more unique the situation because, but in reality, it's going to be kind of like 3 weeks of December, like, oh, well, this is so painful, and probably another 5 weeks in January, February, and then the cases are going to start coming down. Most people will get immunized, and the worst part of this nightmare is probably going to be over.
Great. We like the nightmare being over. We'll move to the next slide with that idea in mind. So obviously what we've been all trying to do in this school year is get kids to school, keeping both our students and our staff safe in the in-person learning environment. Everyone's done an amazing job. Whoops, back one. Everyone's done an amazing job of that. Masking is huge. And so the vigilance around masking is really important. Actually, vigilance around all of the guidance, but masking especially. We know that you know, the days are ending earlier, it gets darker earlier, so people are going inside, kids aren't outside as much, and it's colder, that we're going to have rainy days. So you've got more people gathering indoors for different activities, including perhaps eating. You want to try and figure out ways to mitigate those circumstances that can sort of incubate COVID indoors. Make sure you've got cross ventilation if you're eating indoors, you know, at least 6 feet apart on that. And if there's any way you can set up more permanent, like awnings or sort of 3-sided spaces outdoors that can keep kids dry and relatively warm and still get them outdoors to eat. Those are all worthwhile investments on the part of the school community. So key word is vigilance here. And I think that's what we would encourage you to message out to your school communities. Next slide. So County Health is just a great partner with the County Office of Ed. Our teams are on the phone once or twice a week, getting updates on sort of the weekly trends. And then as we see cases come in, especially when they meet the sort of textbook definition of an outbreak, we're being notified immediately. And then I am connecting with the superintendents to make sure that the outbreaks are on their radar. You know, outbreak feels like a really emotional word and can trigger people's concern. But really, you could have 2, 3, 4 positive cases inside a classroom, but 2 kids live, you know, are siblings living in the same household, and the other child is riding in a carpool. So there's all these like obvious ways in which kids outside the classroom are interacting and engaging. And yes, they end up, you know, going to class and, you know, they're in the same class, but that doesn't mean that inside the classroom, you've got spread necessarily. So you really have to understand what are the context around the outbreaks. You don't necessarily have to communicate to your community that anything's being defined as an outbreak, only that you have positive cases and how you're responding. So San Mateo County Health has been receiving about 30 to 40 reports of positive COVID cases in schools each week. They've seen sort of a steady increase in that over the last couple of weeks. So maybe 2 weeks ago, it was 30 cases. Last week, it was 36. This week, it might be 42. So you can see that we're on that upward climb on the roller coaster. Most of these reports, the majority, are for just 1 or 2 cases in the school community among students and or staff. The reports are coming in through the various mechanisms. If you're not using SPOT yet as a reporting mechanism, we can provide some support for you to get connected to that system. I think it's effective, but you can also send your emails and call communicable disease, the phone number there. So right now there are currently 4 active outbreaks that we're watching in different school communities across the county. And as I said, we're starting to see that increase in cases, signaling the beginning of a winter surge. Next slide, please. So on vaccinations, we're doing a great job in San Mateo County. Last week was, I think, the first week or 2 weeks ago of the vaccinations for 5 to 11-year-olds. This week, we're implementing the 4 school-based events that we had organized. So we had, I think, 700 appointments available in San Mateo, Foster City on Monday. Pacifica had an event this week, Jefferson Elementary, maybe yesterday. I know Bernie's on the call here. And then today is in Redwood City. And those appointments started at 500 appointments. They filled up really fast. In some cases, our partner Safeway was able to add 200 more slots to those. So we got a lot of bang for the buck this week with the young, the 5 to 11-year-olds on school campuses, but also the county is supporting the events at the event center, and they're setting it up as a playland. So it's enticing for younger kids and feels more comfortable and more maybe a safer space than if they weren't doing that, and it just felt very sort of institutional and cold and sterile at the event center. But the Playland event will open next Wednesday from 9 to 1, the day after Thanksgiving from 11 to 6, and Saturday, the Saturday after Thanksgiving. And then you can encourage your families to sign up for appointments on My Turn. They can get appointments through their pharmacy, the local pharmacies, the event center, and then the school-based events. We will be standing up some additional school-based clinics in early January. So we'll be sharing more information as that comes. And then you can go to the San Mateo County Health website for additional options. So we obviously want to get as many 5 to 11-year-olds started with their vaccinations so that we can mitigate these, the winter surge in our school communities. Anything to add, either Curtis or Melissa or Justin on that?
That's a great overview, Superintendent McGee. Yeah, I think like your previous newsletter was a great model of great communications that the school districts can utilize. And I think Patricia and Jill are putting together a new one that might go out this week. Or, I think the Playlands appointments do offer hundreds of appointments. There's also appointments are going to be increasingly available through, Kaiser is quite open right now, and just be explicit and specific about that. The Sutter clinics and the private clinics are now having openings, as well as you can schedule, and just to be like the language from their trusted schools and school districts about like going to Walgreens and CVS and Lucky's. I want to make sure I'm accurate. I mean, you're accurate in your newsletter, Nancy. I think those are going to be really important to encourage. This is that time where, just including like Spanish for that might be really helpful, would be really helpful as well too. It's going to make a big difference for kids. It's going to make a pretty big difference in public health and health outcomes. It's going to make a pretty big, I think, difference in, doing the quarantine and modified quarantine aspect too. So again, your communications to your students, and I've got 3 kids in public schools in San Mateo County, are probably much more effective than anything we can do within our public health department. So really, really grateful for you to be able to be adopting the language that we have, and even making it better would be really great.
Yeah, so we are continuing with the vaccination updates every Thursday. And if anybody on the call, if you're not receiving those, can you just reach out to Patricia Love and we'll add you to our email list. And then those should be shared out with your family communities. Amber, I know we really would love to get them out in Spanish. And that's a goal for us, but we're scrambling to get them out every Thursday. So we will keep aspiring to get one out in Spanish as well. So your point is well taken, and we know that would be the best case scenario. And then, like we said, we're putting out a new holiday update today, and a holiday guidance today. And that will for sure be translated into Spanish.
Nancy,
Yes.
So there is a question here, just, and maybe Curtis can address this. On the SMCH website, it lists interested in bringing a vaccination event to your site. Person had active parents trying to do this, and there are no more events available to schedule. So the website says one thing, but when they follow up, it seems like that's not the case. So I don't know if Curtis, you have kind of anything to share on that.
Yeah, those community events were for adults for their primary vaccination. I think the major challenge we're having now is that the number of people, healthcare workers who can administer pediatric vaccine is limited. And as you can imagine, there's been a huge spike in the hugest spike in demand for these pediatric nurses who can be doing this and contractors who could do this, because every county across the state is trying to do the same thing. So yeah, that's why there isn't a, in terms of like the county's approach of having like our contractors and our staff being able to do vaccination events. Those vaccination events have been in health equity zones, basically, in communities or primarily Black and brown, to get primary vaccines for adults.
And then I would say also that to that point, we've actually been working with the county and county health on deploying school nurses for additional pediatric vaccination events in January. And so those are the additional events that we'll be sharing out, but we first had to get organized around the workforce. So kudos to our amazing county cadre of school nurses. You guys are amazing. I know many of you are on this call, and many of you have signed up to be contractors on those January events after school hours and on weekends. So because of your effort, we're able to offer additional events, but your own individual school communities, there's really not enough staff capacity out there to do pop-up events. So I don't know if we can work with the county on whether they can have a disclaimer on that website about, sign up for a pop-up event here, that it wouldn't apply to pediatric events.
Yeah, I could do that.
Yeah, because PTA parents are seeing that and wanting to like host a pop-up event, and then they follow it up and then they get a note that, oh, can't do it.
Okay, I'll do that right now. Thanks.
Okay. All right, so next slide, please. I think, Jill, is this my last one or are you taking this one?
This is still you, Nancy.
Okay, here we go. Safe, COVID safe holidays. So this is really kind of the message that we want to get out to everybody today, because there's a lot of elevated emotions and energy around the holidays, because people are making plans to go visit grandma and grandpa, and they want to make sure that they get to do that, but they don't want to miss school. So you can see the beginning of our little flyer up there. We'll be putting it out today. And here's sort of a summary of the key messages. Get vaccinated. These are all the, logical, typical things we know that work in COVID safe behaviors. Stay home if you're not feeling well. Stay home if you're exposed and not vaccinated. Wear a face mask. Keep gatherings small. Try to gather outdoors. Be cautious when eating. So for travel, we'd really like you to focus your message on behaviors, not so much on travel. You can travel in a car to grandma's house in San Diego, for example, where grandma is vaccinated, you're keeping your gatherings small, you're wearing masks indoors, and your behaviors are really super COVID safe. So just because you did those COVID safe behaviors in San Diego doesn't mean that, you know, you would have to quarantine coming back to school. If you don't travel and you go next door to a big giant blowout New Year's Eve party and everyone's singing and drinking and shouting and no masks and hugging each other and kissing and all these wonderful things, those behaviors are really dangerous. And the only place you traveled was to the next door neighbor's house. So the idea of travel is sort of the wrong context. It's really about behaviors. And so there's been a lot of confusion about, are kids required to quarantine after they travel? And California Department of Public Health confirmed this yesterday in the statewide call that children are not required to quarantine. So many of you may have been enforcing a quarantine in your schools. You can now adjust your policy, and we recommend that you do. What we do encourage is to help your community self-monitor for symptoms for 14 days, kind of marking days 3 and day 7. After any, you know, like let's say you did travel and you were on a plane or on public transit quite a bit and all that, you just want to pay attention that if you start to feel symptoms, that you stay home right away, you test right away, and you're alert to what is happening in your body if you've been traveling. All right, passing off to Nurse Jill at this point.
Can I just say something real specific about that?
Sure.
I think you highlighted the main ideas really well, but just to be very specific, the CDC Travel Guidance website still has something that still says CDC recommends for individuals. They didn't say individuals, but it's really for individuals that they quarantine after travel. So we're saying that that's not something that schools need to require. Schools should not require that. So we're talking to schools right now. So if you just traveled, you should not require students to quarantine. So that's why we're focusing on that, because I think some schools are confused by that. So
yeah, and I think there's also confusion about a requirement and a recommendation. So everybody tune in right now. CDPH and San Mateo County Health direct everyone to the CDC for their travel guidance. That's the only place where travel guidance exists, is with the CDC. And the CDC's guidance is recommended. They are not requirements. And what we're trying to do in the school communities is get kids to school and keep them in school. So no requirement to quarantine.
the recommendations for children to be in school is stronger than the recommendation for kids to be quarantined, basically. I think that's just a recommendation in general for people, not necessarily kids who should be going to school. So, thank you. Thanks for letting me focus on that a little bit. That's like the source of a lot of schools' confusions.
Yeah. And so Jill's going to take us into more detail around testing and all of that, that all has to do with the travel and the holidays as well. So Jill.
Thank you. And thank you, Dr. Chan, for taking that on, because that is a big concern of a lot of school nurses, school health offices, and school administrators. So thank you for clarifying that. And also just wanted to piggyback on, I want to give a shout out to school nurses with whom I meet regularly, and just this other information that Superintendent McGee was covering about being wary, being careful during this time when kids are ill with other things as well. And there was a big conversation. I was in a meeting yesterday. Nurses and other school administrative staff are spending many, many hours vigilantly combing the absentee lists every day and trying to reach out to every family and make sure that they are following the illness guidelines and the COVID protocols. So that's just a huge piece of work that we're not thinking about. And I really tried to thank them deeply for that. And don't forget to thank your teams who are doing that work, because it's a lot. That's just sort of a undercurrent that's happening during the COVID surveillance activities that everybody is doing. So also, I just want to talk about a couple things from CDPH. I don't know, I hope everybody knows about the Safe Schools for Readiness Hub. That's a CDPH. That is something that, you know, is for school administrators. There are some portals for parents on there too. During our meetings with CDPH, they often tell us what's going on in there. The link will be in the slides. They would like to point out that there's an interactive decision tree. That's kind of a new item they have. So for those of you who are super visual and love to have an algorithm that has every single possibility, that's a resource if you want to look at that. There's also a mobile app that is part of that. So if you really want to use something like that, you can do that. We have a pretty simple algorithm in the pandemic recovery framework because I like simplicity, but if you like more detail, you could find it on that interactive decision tree. Also, there's a hub for requesting information. I mean, just want to point to you to look at that for resources if you haven't seen that. There's something called Share. This is not something that is guidance from CDPH, but where different entities such as administrators or health departments or whomever shares what their practice is on something, not that it's a policy by CDPH, but maybe to give you an idea how to think about an issue that you're having that you might want to change your personal policy on in alignment with guidance. Another thing is they do have FAQs on that site, and they did update those, I believe it was the 15th this week. The highlights of that are, there's a whole new little subcategory, I think it's 1A, which is how to evaluate post-vaccination symptoms in students. This is a big thing, you know, kids who have runny noses and then or a fever or something, and then they have a vaccination. And how do I know how to evaluate that? So CDPH has some guidelines on there. And so that's interesting, and make sure, I think school nurses are probably aware of that, but maybe that's, if they're not, they could be looking at that. And then also of the point that if your students get vaccinated, it will not cause a positive COVID test. So if somebody has symptoms and they had that are outside of what COVID really looks like, and you think it's appropriate for them to test, having had the test is not going to create a positive COVID test result. So I hope that makes sense. There's a couple other things. There's some clarification on their gathering guidance and a couple other little clarifications on there. And then also just to let you know, we're going to talk more, I'm going to talk more about it, but you know, there's a big push to increase the cadence of testing and be prepared. So CDPH, the state testing task force, is ready for your extra supply requests, but and they don't have any supply chain issues right now. Of course, if everybody waits to the very last minute, there probably will be some congestion. So they've been saying it, we've been saying it, so I'm saying it again, get your orders in. Okay, just to review contact tracing, I think most everybody in this room has had experience doing contact tracing now. And usually if it's your first time, some of you are really lucky and you're still having your first, or, you know, first couple or first experience, and that's always the worst and most difficult. But just to remind you that the idea is to identify people who've been in contact with somebody who has an infectious disease. And reminder, schools are contact tracing within the school and the school district, and San Mateo County Health is doing the contact tracing of those who are determined to have originated outside the school. Now, San Mateo County Health is supporting you in your contact tracing efforts, helping you figure out who needs to be followed up on and what the policies might be. Because what I'm really amazed by on a day-to-day basis is how many unique stories there are about somebody's COVID case and their contact tracing. And it's just an amazing amount of personal stories and unique situations. So we all need guidance and help from the crack contact tracing team from San Mateo County Health. They really know their guidance very well. How to do it. I know you all have heard about Spot, and most of you are now using it to make your reports. The reason, if you're not, the reason why you might want to is for the following reasons. California Department of Public Health gets an immediate reporting so they can track the data more easily. That helps inform policies, that helps update policies that you're interested in getting updates on. And that's the kind of data that helps the policy planners to make their decisions. It helps you have a quick access to data for your school dashboard because it's available there on the Spot website. And you can just jump in there, do your due diligence, make your report with the minimum, and then come back and fill in later. So you have that option and you've done it, and you can come back and put your details in later. Alternatively, I guess the next best thing, if you're not using Spot or you can't use Spot for whatever reason, is to use the email address. The email address, the Spot contact sheet, I forget the name of the, how you start the report, and the phone number, it's all in the pandemic recovery framework. So if you need a link to that, it's easy to find in the pandemic recovery framework. I think we already talked a bit about this. This comes up because the word, as Nancy pointed out, is a bit provocative, and the definition is 3 or more cases that are epidemiologically linked. So not within the same family, and within the last 14 days. This is but the focus is not, oh, it's an outbreak, but how manageable is the situation? And with that information, San Mateo County Health helps guide individual schools on what decisions need to be made. The contact tracer will confer with the team. The San Mateo County physicians, such as Dr. Chan, will advise them, and very rarely would that result in a school closure. So just to let you know that even though it might be defined as an outbreak, it's really on an individual basis, just as all those individual case stories might end with a different, a slightly different plan. So modified quarantine is working. I mean, I was just thinking about the brainchild of modified quarantine, whoever came up with that, Dr. Chan, really did, or whatever that team, whoever that team was, they did such a great job. It's really working. Kids are really in school. I mean, they're identified as being essentially low risk. Sometimes yesterday I got a question, is it really okay for kids in modified quarantine to be at recess with others? And I had to remind them, yes, these kids are identified as low risk, and we're doing a great job keeping them in school and managing that. So thank you to your team for coming up with that great idea. As I said, classroom closures are very rare. And also just to let you know that contact tracing, certainly I hear this from school nurses, it's the one bear that is just so difficult to do. And many nurses and other school personnel are working throughout the weekends and late at night doing this contact tracing work, and it's not easy. But there are ways to get help, and one of them is worksite labs. I think you all know about it. We have a contract with worksite labs. Number of schools are using them, particularly for testing, and that is going super smooth. Testing is pretty easy with them. They're very accommodating to your particular schedule and desires. That is no charge to you. There are also services for contact tracing, and some of you have been using that, and maybe you could be even using it more fully. So I think that it's certainly something to explore. And if you do have the contract, or you're interested, or your staff are really burned out from doing so much contact tracing, to really look at that as a resource and try and work with worksite labs and give over some of that, give over the work to them and set up systems that really help you and your staff focus on all the other work you have to do.
And Jill, I'm gonna pop in here just real quickly. We've been joined by Bonnie Holland, who's leading the all the interface with the schools on contact tracing with county health and communicable disease. So thank you, Bonnie, for being here. And I think she can answer individual questions as they come up later.
Yeah, so thank you, Bonnie, for coming. I really appreciate you and your team. I hope you were here to tell when I said that.
Yeah,
And
thank
your and your availability at any minute of any day to answer all of my questions. I really appreciate you. Okay, so testing. We have a flyer. I think Patricia is going to put the link in the chat. She may have already done so. I actually can't see the chat right now. Basically, it's divided into 3 sort of big areas. Developing a plan. Hopefully you've already done that part. When you're developing your plan, focus on unvaccinated students and increasing testing cadence around the holiday times. And then prepare what you need. A second big area. That means order extra supplies and testing services, hours and days. So if you're using, for example, worksite labs or some other private contractor, make sure you let them know what your need is. I know that, for example, I know schools who have extra and really like Sunday times with worksite labs showing up to do clinics before kids come back. So there's a lot of good services out there. So make sure you get that set up ahead of time based on what you decide what your plan is. Or get your kids consented and forms. Like if you were going to be testing kids who are not currently involved in testing programs, make sure and get that all set up ahead of time, because one thing I do know is that if you have done your uploading and your consenting and have all of that done ahead of time, doing an actual testing event is not that hard. It may take time, but it's less complex. And a third big area is to communicate early and often. Share your plans and your resources with your families and your staff. Make sure that everybody on your team who's involved in COVID knows, so that if somebody asks at the school nurse level, for example, they know the plan and they don't have to come back and ask you again what the plan is. So share among the people in your own organization and with all your families. Interesting point about, I didn't actually make this that clear, but if you're using rapid antigen testing, which many of you are, using the Binex now, or there are a couple other products out there, confirmatory PCR testing is, in most cases, is no longer required. If you have, at a time, there were quite a few requirements for confirmation. So that just makes it a little bit easier for you now to know that. In most cases, meaning that unless you have, the way it's been explained is, unless you have something that is really strongly suggestive of COVID, for example, somebody has a loss of taste or smell, or their complex, unique story really directs you to think that there's COVID in their family or something, then, and you get a negative rapid antigen test result, you might want to consider confirmatory PCR. I would use my school nurse team to help me with that, because that's something that school nurses have been doing forever, and then particularly about discerning COVID from other viruses. One thing that was that being said, one thing that was discussed yesterday in a CDPH meeting was, well, how can I tell the difference? Because a lot of kids just have runny noses, and we've already discussed that other viruses are out there. And really, the truth is we just don't know. So kids who have runny noses should get a COVID test because we just don't know. So increased testing because it's cold and flu season, increased testing because people have different behaviors during holiday times. There are a lot of reasons for that. Home testing is still not recommended for release from quarantine, so that hasn't changed. But if people are using home testing kits for travel purposes, I think that's good. I know we have an event. CDPH is sponsoring an event in San Bruno. I don't have the link here, but I know that one of the things they're doing, and I believe it's on, I can't remember exactly, but Patricia probably can help me with that. And one of the things they're doing is doing rapid tests and sending home kits test home for follow-up in a couple of days. So anyway, so rapid tests are good. And in this case, and home tests in some cases.
So, oh, yes, your two questions.
Yeah, sorry.
There was a question in the chat about modified quarantine and whether students can participate in extracurricular activities. And the CDPH guidance says that they cannot, but especially in relation to like after school care, if the after school care is run on site by the school staff operating school protocols, students can extend into the after school care. Is that right?
That's correct. I'm sorry, I was answering too quickly and didn't read closely. So it only applies to after-school care. That if it's on the school campus and staffed by school staff, students on modified quarantine can go to after-school care, but it does not apply to extracurriculars like sports.
Right, sports or clubs or drama or band or music or all those kinds of things that kids would do if they're on modified quarantine, they should not be participating in those activities that are sort of choice activities. But after school care is more of a care need and a family need. And so if it's on site within the school district operations, they can continue to go to after school care.
Sorry, can I just clarify too? So we have this was my question, it's come up a lot at our district. So we have after school programming that's a combination of arts and crafts and sports that's run by a program within the school. So does that still, it's staffed by volunteers who they abide by all the same guidelines as school staff. They're vaccinated but so how does that count? So it's on site, it's only students in the district, it's after school, and it's a combination of there's basketball, there's yoga, there's crafts, there's art, there's math. Where does that fall?
But I think that's basically after school care, right? I mean,
Okay.
Yeah, well,
go ahead.
That's
Curtis.
what I heard from DPH earlier this year, but now that we've had just more cases in the last few weeks, people are wanting me to be very explicit about that still being possible.
yeah, that was actually, thanks to you all, that was actually a policy that we established for CDPH. So we defined it as after school care for basically families who are working, and it's not for youth development, not explicitly for youth development for particular activities. You know, for us, it's a social and racial justice equity issue for families who are, you know, it's for after school care that they otherwise don't have care. You know, I think there's a time when we could be more, let's say, more lenient about that and say, well, youth development is actually really important too. And I get that it's important to have yoga while so many kids are stressed out. Right now, at the beginning of this winter surge, I would say that's not a good idea to be more flexible and liberal in your interpretation. I think it's good like for us to even as a state to have this modified quarantine to allow kids in school is actually a modification of what quarantine requirements should be. So I would encourage basically like the 21st century after school care programs that are for low income families. Those are good things to continue because we don't want to have to pull parents out of like the work to take care of their first grader like after like 2:30 or something, from 2:30 to 6. But like for families who are just, this is like an hour and a half yoga plus basketball, that's like violating what the spirit is. And also, yeah, it's violating the spirit as well as public health recommendations.
Great. Does that help? I think that helps clarify. So other questions we have,
Sasha has her hand up too.
oh, okay, I'm sorry. Sasha?
Hey, hi, thank you guys very much. I just want to confirm. So if we're not doing a quarantine, then I shouldn't put any practices into place for these specific kids who I've identified are traveling, and they'll be traveling a distance, and they may be around other people that are unvaccinated or unmasked. I'm still just going to do testing at least on day 1, day 3, maybe day 5. And that is sufficient as long as I continue to get negative tests. I do not need to be putting in any other systems to ensure that we're all safe at this. I mean, other than everything else we already have in place. I'm feeling nervous.
Who's going to answer, Sasha? It's not gonna be me. I'm not the medical person. So it's going to be Bonnie, Jill, or Curtis.
I'm just nervous because of the change in the quarantine, and
Yeah.
I'm just nervous. That's all. I just want to hear it again.
Yeah.
I just say I'm nervous as well too.
Oh
So,
gosh, Curtis.
But I think what it is like, we're nervous for all of like the winter holidays, because if like somebody goes to grandma's house, at least they're not like hanging out with like 4 different neighborhood kids like every day, like my kids would be, or something. My kids probably wouldn't be, but like, let's say like that risk of just being around all your friends in your neighborhood are a lot different if you and your whole family decided to go skiing or to grandma's house in Salinas or something like that. So there's an imbalance in terms of activities, that the activities and exposure of travel are not much more than activities of other social interactions in this community, because our rates are about the similar in California, within California and within the United States. It's kind of similar. And there's also differences in reporting too, like the families that will report to you in their way that they interpret travel. There's going to be differences in which families are going to like look at the policy and regard or disregard it, and there's inequities of how they're going to interpret and report to you, and therefore you're going to be in a position where there's going to be differences in how you're going to enforce the policy and how kids are going to be excluded. So that's our kind of guidance for it. But I think schools, you all know your community better than we do, but that's like our public health logic behind not enforcing what the CDC is recommended.
So there's several questions in the chat about home testing, and tests being done unsupervised. How do families report those results to the county or the state? And a hesitancy to accept home tests, and then another school district saying they do accept them. So I don't know how we want to break them down, but maybe Jill, you can dive into these since you probably get these all the time.
Okay, well, yeah, thank you. I think that nothing has changed in the guidance around home testing. We still have the same issue. The reason they're not generally recommended for school surveillance is because we can't control the details. We don't know who swabbed whom, how well of a job they did. We don't really have a means of recording it and seeing the results. So that hasn't changed. The only thing that has changed, I hope that this is clear, is that in terms of post-holiday ways that people can help us manage our communities, is if they want to use a home test, great, we should, that's another tool. And even to the point where CDPH is doing this event in San Bruno, they're doing a rapid test in the moment and giving people this ability to go home and monitor themselves and make a decision based on that. And I think that from what I understand from guidance from Dr. Chan is that this is kind of the wave of the future. We are turning over this kind of responsibility or these tasks to people to monitor themselves and to try and make good decisions about the health of our communities. And I think that our responsibilities as schools are to share our expectations, what we expect you to do. If try to minimize your risk. If you do risky things, get yourself tested. Here are some options. If you're symptomatic, stay home. So I think, and hopefully the guidance that we put out with our flyers will be helpful to you, and however else you communicate with families.
And then Sarah Devaney from San Mateo Union is saying they've seen a lot of cases of spread within the household when a student's fully vaccinated. And is there any thought to the guidance being updated? So I kind of want to share my learnings on this, Sarah, and then, Dr. Chan and Bonnie can weigh in, but essentially we're sort of in transition with the pandemic where COVID is on its way to becoming an endemic, where COVID is going to become like the flu or the cold. And we still get flu shots, and that helps us prevent flu. And when we get the flu, it helps mitigate the severity of the symptoms. And so when we get a COVID vaccination, we're basically choosing, and this is sort of those who are not vaccinated. The question isn't, should I get vaccinated or not? The question is really, do I want to have protection against severe illness or mild symptoms? So when you get COVID and you're not vaccinated, you're much more likely to get severe symptoms and end up potentially hospitalized. If you're vaccinated, many of us over the next several years are probably going to get COVID at some point, like we get the flu, even though we're vaccinated, but our symptoms are going to be milder. So as far as CDPH or anybody changing guidance to address the fact that the vaccination isn't preventing 100% the contraction of COVID, I don't think we'll see any changes. How'd I do, Dr. Chan?
That was perfect. I was kind of mesmerized in the lecture. I was like, oh, I should say that, Superintendent. Yeah, so I think for this community of like school leaders and school health leaders, I think the CDC, the Biden administration, WHO hasn't formed the narrative yet. I think like what's a narrative in many like health officials' minds, but it's not spoken yet, is that COVID-19 is something that was like several folds, maybe up to 10 folds as deadly as flu, right? It's something like that. Particularly for older adults, maybe not. It's not that high of a difference for young children, but with the vaccination, which is about like at least 90% effective, so it brings it to be about like once you're vaccinated, about as problematic as the flu. So that's one way you could think about it. It's going to be kind of like how we're going to be once most of the population is vaccinated. Our processes and procedures of how we think about this is going to be similar to the flu. I think the Biden administration and public health in general doesn't want to say it's like the flu right away, because that's going to discourage people from getting the vaccination, which is going to make it like the flu, because Delta variant is still very, very infectious, more infectious than the flu. So you could still get huge outbreaks of the flu. It's still not a good idea. So what it means for school is all these procedures about isolation, quarantine, modified quarantine. Those are some of the things that we still might do for a severe pandemic flu season, for a severe flu season, or severe. So yeah, I think so. That's a different, the similar approach that what Nancy said. I don't know. How did I do, Bonnie? Was that not as good as Nancy, but maybe you have a better spin on it.
Yeah, Nancy was very eloquent. I think we should just, I think she's been on so many calls with us. She could be in charge of public health now.
Perfect.
That's
I have some,
that's quite funny. Thank you. Jill.
also, I just want to say that public health has always, San Mateo County Health has always supported school health in guidance around contagious diseases. There's a table that exists that guides a school on how to determine whether or not a report needs to be made, if contact tracing, I mean, that's not a new concept. It's something that has always been done for different infectious diseases based on guidelines. So eventually, maybe, COVID will get on that list, and there will be very specific guidelines. If this many cases, call, confirm, do this, send out exposure notices. So I think that, San Mateo County Health has always given us good guidance on how to handle infectious diseases. So thank you.
And so I think we're out of time. Am I right about that? We had an hour, right? So we took a little bit longer than that. So we apologize for the 5 extra minutes. But we believe that this is an important conversation that we had today, because we're continuing, like, the scenarios are continuing to evolve. This isn't a stagnant conversation. So we've got to go in every so many weeks or months and sort of reset our understanding and our expectations and our practices. So the big thing is the key practices of masking, staying home when sick, monitoring, implementing modified quarantine with testing, and encouraging and creating access to vaccinations. All those things need to continue for now. And for you guys to know that your contact tracing testing in response to positive cases is likely to go up over the next couple of months. We came down on the roller coaster. We got to sort of the bottom of the hill for a bit. We got a little bit of a breather. And now we're going to start to climb back up and ramp back up to be ready for contact tracing testing. We had a meeting with Worksite Labs yesterday. They do have the capacity to take on new communities with supporting your testing, and they're more than willing to work with you on contact tracing. It only works if you're really willing to hand over the contact tracing to them and let them do it. If you kind of try to do it half and half, it doesn't work as well. But if you need that kind of support, they're available to talk to. And if you need us to help you connect to Worksite Labs, Patricia, reach out to Patricia and we can get you connected. A reminder from Bonnie, please have your students wearing masks on the bus. And use hand sanitizer getting on and off. We're seeing increasing, cases coming from situations like that, where, you're on the bus on the way to school. People might think, oh, I don't have to wear my mask till I get to school. Not true. Once you get on a bus, you're at school. So please, copy the chat. There's lots of good information there. We'll be sending out our vaccination update today. That'll have a link to the new holiday guidance. Thank you so much to our partners in County Health, Dr. Chan, Bonnie Holland, Melissa Ibarra, and Justin Watkins for being on the call today. And thanks to all of you for your time and energy. If you didn't get questions answered, follow up with Patricia and Jill. They will get back to you. All right, so for now, we'll turn you back over to your day. Happy Thanksgiving, everybody. Grateful to be partners with you.